Hi, Isabella. My name is Jaden and I am your student nurse. Today I will be performing a head-to-toe assessment. Can I please just check your ID band and can you tell me your name and date of birth?
Isabella Westlake, September 14, 2004.
Awesome. So right now I'm just going to sanitize my hands. Can you tell me any allergies you have?
I don't have any.
Do you know where you are today?
The doctors,
Do you know why you're here?
because I got hurt.
And do you know what year it is?
2020.
Perfect. Everything looks good. So right now I just take her vital signs and I'm not going to do that just for the sake of time. Okay. Right now I would just be looking at her eyes. So I'm going to grab my pen light and I'm just going to be looking for her pupils to constrict. Normally I would have the lights off, but just for time's sake and video quality, I'm not going to do that. So I'm just going to look for her pupils to constrict just like I said. Perfect. So that looks good. So now I'm just going to assess her pupil movement and symmetry and make sure that all looks good. So can you please just look at my pen light? Don't move your head. Now follow it. Perfect. It looks good. All of her sockets look good. She has no drainage. So now I'm just going to look up her nose. And now I'm going to look down her throat. Perfect. Now just in her ears. Perfect. Everything looks good, Isabella. Can I ask you just to smile for me? And can you raise your eyebrows? Perfect. Everything looks good, dealing with her face and her cognitive ability. So now I just move down her chest. Can I ask you to lay flat for me, Isabella? Okay, so I just assessed her chest size right now. Make sure everything looks good, even, there's no bruising. Her color's good. I'm just going to assess her temperature. Also, I'm going to feel down her arms just to make sure that there's no bruises or anything. Let me just fix these covers for you. Okay, so right now, I would just listen to her heart sounds. Perfect, everything sounds good. And then I would just auscultate her apical pulse for 1 full minute and make sure that sounds good. And I would also listen to her lung sound, so I'm going to do that real quick. So can I ask you to please sit up for me? Perfect, let me just put these back on. Deep breath in, out, in, out, in, out, in, out. Now I'm just going to do your back. In, out, in, out, in, out, in, out, in, out, in, out. Perfect. Everything sounds very good. I listen to her breath sounds from bilateral to top. And then, okay, so can I ask you just to lay down for me? And can I just pull the blankets down to listen to look at your abdomen? Can you pull up your shirt for me? Perfect. So now I'm just going to look at her abdomen, make sure there's no bruising, swelling, and no redness. Make sure everything looks good, Isabella. Your skin looks very good. So now I'm just going to listen to your bowel sounds. And can you tell me the last time you had a bowel movement?
This morning.
This morning. Perfect. So now I'm just going to listen to all 4 quadrants and make sure that there's bowel sounds in all of them. Perfect. Awesome. Everything sounds very good, Isabella. So now I just palpate all 4 quadrants, making sure there's no tenderness, swelling, just any of that stuff. So I'm just gonna do that real quick. Perfect. Everything looks very good and feels very good, Isabella. And then I also forgot to mention at the beginning of my video that I would raise the bed to my working height so I wouldn't hurt my back. So there's that. Are you having any pain with your urination?
No.
Perfect. Is your urine normal? It's clear for the most part. It's a light yellow.
Yes.
Awesome. She doesn't have a Foley catheter, so I don't need to inspect that. And if she did, I would make sure that looks all normal. And she's continent. Are you continent with your urine?
Yes.
Perfect. Okay. Everything looks good. So now I would just move down to her lower extremities. So can I ask you to please take your legs out of the covers? Okay, perfect. So now I just feel her skin, make sure everything feels good, there's no tenderness. Perfect. Actually, before I move to her lower extremities, I would go back to her hands, and I'm just gonna check out her hands. Everything looks good, her skin's normal, her nail condition is good. Now I assess her cap refill and make sure it's below 3 seconds. So yes, that looks good. And then I'm just gonna assess her radial pulses bilaterally and make sure they're even. And can I ask you to push on my hands? And can you pull back? And then can you just squeeze my fingers? Perfect. Her muscle or her pushes and pulls and her motor skills are all even, so that's very good. Can I ask you to raise your arms for me? And can you raise them to the side for me? Perfect. Go ahead and go back down. So now I would move on to her lower extremities. I would just be feeling her legs, making sure there's no bruises. Perfect. And I just assess her skin temperature. I'd assess how her skin looks. And now I would just, yeah. So now I'm going to assess her pedal pulses. And I'm going to assess if there's any edema on her feet. Perfect. They feel even, so that's great. And now I will just ask you to lift your legs for me. Can you lower them for me? Can you rotate your ankles around for me? Perfect. Okay, so now I'm just going to ask you toes to nose. Okay, now driving. Perfect. Everything looks good. So you have leg strength. They're symmetrical. So now I just look all over her skin, make sure everything looks normal. If she had any wounds, I would check the wounds, the drainage, any of that sorts. And then whenever she would go to the bathroom, I would assess her gait, which is of course walking. And then I'd also assess her range of motion, her balance, and her strength. Perfect. So thank you so much for letting me perform an assessment on you today, Isabella. I would now wash my hands, document all of my findings, thank my instructor, and then, yes, that's it.